Hey, how's it going today?
Good, thanks.
So, as we have discussed last week, judging from your x-ray and clinical symptom, it looks like we have to do a non-surgical extractions on your maxillary central incisors and your mandibular right canine. So, the benefits of removing infected teeth is to remove the infection itself, and the benefits would be to relieve pain rapidly, but there are some potential risks like your teeth shifting, and there's also post-surgical risks such as pain, swelling, burning, bleeding, and infection. Do you have any questions regarding the procedure we're doing today?
No.
Okay, could you sign this consent form saying you agree to this procedure? Alright, but before we get started, we have to go over your medical history and take your vital signs. Seems like you are healthy. Are you on any prescription, over-the-counter, or any herbal supplements?
No.
What about aspirin, Tylenol, and Advil?
No.
Alright. Now I'm going to take your vital sign. I place the blood pressure cuff superior to your antecubital fossa, and the stethoscope will be placed over the fossa as well. Alright, looks like your blood pressure is 115/70. It is normal. And now I'm going to take your pulse with the stethoscope as well. Okay, looks like your pulse is 70 beats per minute. It's also good. Okay. You should be fine with this procedure. Assemble the mammatorium. I'm going to take the needle that is capped and screw it into the syringe. I will pull the harpoon back and place the carpel inside the syringe, and I'm going to push the ring and engage the carpel, and then I'm going to check for flow. Now we are ready to go.
Sounds good, doctor. Which injection will I be getting today?
You will be getting a maxillary infiltration and a nasopalatal nerve block for your upper two teeth, and we're going to use 2% lidocaine with 1 to 100,000 epinephrine. So for the maxillary infiltration, I'm going to dry the mucosa of the mucobuccal fold with a gauze, and I'm going to place the needle, a short needle parallel to the long axis of the teeth, and I'm going to slowly inject. And for the nasopalatal nerve block, I'm going to locate the incisive foramen, which is between the upper two centrals, and I'm going to position the needle at a 45-degree angle to the palatal mucosa and then slowly injects. So for the mandibular right canine, I'm going to administer a inferior alveolar nerve block, and because the canine is farther away from the injection site, it might get anesthetized completely. So I'm going to also do a mandibular infiltration, and I'm also going to give you 2% lidocaine with 1 to 100,000 epinephrine. So for the mandibular inferior alveolar nerve block, I'm going to use my non-dominant hand to retract the soft tissue, and I'm going to place the needle at the deepest portion of the coronoid notch, which is lateral to the mandibular raphe, and I'm going to slowly inject in 1 to 2 minute duration, so the anesthesia will be more. After the needle touches bone, I'm going to withdraw it slightly, and then I'm going to aspirate to check whether there's blood in the carpel, and if if there's blood in the carpel, I'm going to replace the carpel and the needle, and I'm going to put the carpel and the needle in the sharps container and then dispose it, and then I'm going to do the injection again. And if the aspirate is negative, then I can inject the carpel. So after the injection, in order to safely cap the needle, I'm going to use the one hand technique. So I'm going to hold on to it, and the plastic cap is right here, and I'm going to scoop it up, and then when the cap is on, I'm going to tighten it, and then I'm going to dispose the carpel and the needle in the sharps container. Now I'm going to go over the non-surgical extraction instruments. Here's the tongue depressor. Here's the mandibular forceps. Here's the rongeur and the maxillary forceps. Root tip pick, another root tip pick, the cowhorn forceps, Minnesota mouth retractor, the needle driver, suture, suture scissor, small straight elevator, large straight elevator, the bone file.
I'm a little bit nervous now. Can you tell me what you'll be doing?
Yes, so for the non-surgical extraction of your maxillary central incisors, I need to tip the chair back so that your maxillary occlusal plane makes a 60-degree angle with the floor. And I also need to make sure the patient's mouth is at or below the level of my instruments we'll be using in the maxillary arch will be a periosteal elevator, a small and a large straight elevator, a straight forceps, and a maxillary universal forceps. So for this tooth, we're going to begin by using a periosteal elevator to separate the PDL fibers of the tooth. And then we're going to use a small straight elevator to elevate the tooth. And then I'm going to place the beaks of the maxillary universal forceps as apical as possible. And then with gentle motion and increasing pressure from the buccal to palatal side, I'm going to remove the tooth. After the tooth has been removed, I will gently curette the socket, irrigate it, and apply gauze to achieve hemostasis. And for the mandibular canine, the instruments we'll be using will be similar, except we'll also be using a ash forceps. And for the mandibular extraction, I'm going to seat you up more and lower the chair. And this teeth generally has straight roots, and I have checked the radiograph for dilaceration and root anatomy, and it all looks normal, so I think we can proceed. So everything goes well. Do you have any questions?
Is it going to hurt later though?
You may feel some pain after the anesthesia wears off. For that, you can take 400 milligrams of Advil, one tablet every 4 to 6 hours. And if you are still feeling pain after you take the Advil, you can take one tablet of Tylenol number 3 every 3 to 4 hours, and that just hopefully stop the pain. Also, in addition to pain, some minor bleeding is expected, and bleeding can be controlled by applying direct pressure at the site by biting down on the gauze. You have to replace the gauze every 20 minutes until the bleeding significantly decreases or it completely stops. Also, from the day after the extraction, you should rinse with warm and salty water to prevent any spitting motion or like sucking on the straw, eating any spicy or hot food, or any food that can get stuck in the tooth socket. Also, make sure not to smoke for 72 hours after the extraction.
How long will it take to heal?
It will take about 7 to 14 days to heal. So the procedure went well. Can you come back in a week for follow-up just to make sure there's no more any underlying infection? Okay. If there's any persistent bleeding, swelling, you can give me a call at the number I gave you.
Thank you.